Today, let me update you about stroke. Stroke is basically a blood vessel block in which it is called an ischemic stroke or a rupture of the blood vessel in the brain when it is called a hemorrhagic stroke. You must be able to recognize this problem immediately so as to help the patient. And how to recognize this is by B FAST. B stands for balance problems, E stands for problems in the eyes, F stands for face problems, A stands for arm or leg weakness, S stands for speech difficulty, and T stands for time, which is rush your patient in time. Once you have recognized a stroke, you must remember that there are two types of windows of opportunity in stroke. The first window is the 4.5 hour window in which we can give an IV thrombolytic drug to your patient. And the second window is the 24-hour window in which we can do mechanical clot retrieval for your patient or your loved one. Friends, I must tell you that you must take your patient to the right hospital. And what do I mean by the right hospital? That is a hospital which has a proper imaging facility, a proper cath lab, and a neurologist available 24/7 to take care of your patient.
Today I will be describing about mechanical thrombectomy, which is a very important procedure done for acute ischemic stroke, especially when there is a large stroke with large vessel occlusion. Large vessel occlusion means the part of the brain is deprived of circulation due to blockage of a big vessel. In such cases, there is a big thrombus wherein we have to do a procedure which we do in the cath lab or an angiography machine. In this, we enter through the right groin and cannulate or enter into the vessel which is blocked in the brain, and there is a thrombus in that vessel. That side of the vessel is a large catheter is put, and through that there is another technique called as a stent retriever thrombectomy, which is one type of thrombectomy procedure. In this, we put a smaller catheter into the vessel which is blocked. Through that, we put a stent which crosses and traps the thrombus or the clot, and we keep it opened up for maybe 2 minutes, and then we retrieve the stent through the groin along with the thrombus. The vessel is opened up and the circulation or the blood circulation is restored. This is one type of technique called as stent retriever mechanical thrombectomy. Another technique wherein we enter through the groin, put a large bore catheter into the involved or the blocked vessel proximally, and this catheter then we connect to the thrombus proximally where it is blocked. The connection of this catheter into the groin to a aspiration, which is negative suction. It has high negative pressure which aspirates the thrombus connected to the large bore proximally, and it removes the thrombus, which is called as an aspiration technique. The vessel is opened up, the blood circulation is restored, and the ischemic area starts functioning. These two techniques, stent retriever thrombectomy as well as thromboaspiration or aspiration techniques, are very rewarding techniques, and they are promising if done within the window period. Now, this golden window period for large vessel occlusion in acute ischemic stroke has been extended up to 24 hours in selected patients. This, if done, procedures within the time have promising outcomes and results, and patients can improve as early as possible and can be deprived of disability, and they will not have any disability at long terms.
Stroke treatment is time sensitive. Stroke patients should be taken to the nearest hospital at the earliest. The nearest hospital should have 24/7 neurologist on call, imaging facilities like CT scan and MRI, and a cath lab facility. To ensure on-time treatment, Global Hospital Parel, Mumbai announces zero deposit on admission for stroke patients.